Assalamualaikum. We are from Group 4 and we will present about acute gastroenteritis. And this is our members. So, should we start?
Definition: Gastroenteritis is an intestinal infection that causes a combination of vomiting, diarrhea, abdominal cramps, fever, and poor appetite. Treatment: Gastroenteritis can be treated with antidiarrheal such as kaolin syrup and pectin. The second one is anti-motility agents such as loperamide and diphenoxylate. Third one is oral rehydration therapy. This is to prevent dehydration due to diarrhea. Investigation: There are four investigations for gastroenteritis. The first one is physical examination and history taking. This is to assess whether the child is dehydrated or to determine the cause of the acute gastroenteritis. Second one is stool samples. This is to look for bacteria, viruses, or parasites in stools. Third one is antigen test. Stool samples will be studied to detect antigens. And the last one is sigmoidoscopy. This is to look for signs of inflammatory bowel disease.
Hi and Assalamualaikum to Madam Shamila. My name is Shafika binti Mustafa. My matrix number is 3042104. I will continue presenting about etiology of acute gastroenteritis. Acute gastroenteritis is caused by virus, bacteria, and parasite. Most common virus that can cause acute gastroenteritis is norovirus and rotavirus. For bacteria infection, most common caused by E. coli, Salmonella, and Campylobacter. And less commonly is parasite. A common parasite that can get acute gastroenteritis is Giardia. So this is the picture of virus, bacteria, and parasite that can get acute gastroenteritis. For norovirus and rotavirus can be spread by fecal-oral transmission. For bacteria E. coli, Salmonella, and Campylobacter can be found in infected people and animals. They can also found in contaminated water and food, especially undercooked ground beef, raw meat, and juice. Contaminated water, including drinking untreated water and swimming in contaminated water. Parasite Giardia can transmission most likely when you are not washing your hand after going to the toilet or drinking contaminated water and eating through contaminated food by an infected person. That's all for me. I will pass it to my friend. Thank you.
I will continue with the pathophysiology of acute gastroenteritis. First is ingestion or taking of contaminated food and water that was caused by virus or bacteria or parasitic. After the contaminated food enters the GIT system, the organism will affect the body through direct invasion, or the organism also release endotoxin. So the bowel mucosal lining becomes stimulated and destroyed by the organism that had been entered. Then, after the stimulation of the bowel mucosal lining, the human body starts to attempt defecation or tenesmus as the body tries to get rid of the foreign organism in the stomach. So because of that, the diarrhea was occurs.
My name is Shaira Zulaika and I will continue with clinical manifestation. First, watery, usually non-bloody diarrhea. Bloody diarrhea usually means you have a different, more severe infection. Second, abdominal cramps and pain. Third, nausea, vomiting, or both. Next, occasional muscle ache or headache. The last one is low-grade fever.
My name is Shaira Zulaika and I will continue with nursing care plan. The diagnosis is fluid volume deficit related to loose watery stool diarrhea. Supporting data for subjective data is patient filters and weakness. For objective data, patient vital signs show 180 mmHg. Next assessment. First, assess skin tuber and oral mucous membranes for signs and dehydration. The rationale is signs of dehydration are also detected through the skin. Second, access color and amount of urine. Report urine output less than 30 ml/hour for 2 consecutive hours. The rationale is concentrate urine denotes fluid deficit. Third, not presence of nausea, vomiting, and fever. The rationale is these factors influence fluid deficit. Fourth, taking patient when daily with same scale and preferably at the same time of day. The rationale is when is the best assessment data for possible fluid volume imbalance. Fifth, monitor active fluid loss to maintain accurate input and output record. The rationale is fluid loss can cause decreased fluid volume and can lead to dehydration. Next, goal. Patient will maintain fluid volume at a functional level as evidenced by individually adequate urinary output with normal specific gravity, stable vital sign, moist mucous membranes, good skin tuber, and prompt capillary refill. The nursing intervention is first assess vital signs. Note strength of peripheral path. The rationale is to evaluate degree of fluid deficit. Second, keep fluids within client's reach and encourage frequent intake as appropriate. The rationale is to correct or replace losses to reverse pathophysiologic mechanism. Third, control humidity and ambient air temperature as appropriate. Reduce bedding or clothes, provide tepid sponge bath. The rationale is to reduce high fever and elevate metabolic rate. Fourth, change position frequently. The rationale is to promote comfort and safety. Fifth, provide safety measure when client is confused. The rationale is to promote safety. Sixth, administer medication as indicated. Anti-diarrheals. The rationale is to limit gastric or intestinal losses. 7. Establish 24-hour fluid replacement needs and routes to be used. The rationale is to prevent peaks or valleys in fluid level. The last one is administer IV fluid as indicated. The rationale is to replace losses to reverse pathophysiologic mechanism. The last one is evaluation. Evaluation is after 16 hours, patient will able demonstrate behaviors to monitor and correct deficit as indicated.
I'm Kiratul. I would like to continue present this slide about complication of acute gastroenteritis. First, dehydration. This is because body loses fluid and electrolytes that are not replaced when vomit or have diarrhea. It is dangerous for small children, the elderly, and people with weak immune system. Secondly, bleeding from ulcer. It is because by damage to mucosal defense, typically acute manifesting with bleeding but may be subacute or organic with few or no symptoms. It can diagnose by endoscopy. Third, gastric outlet obstruction due to edema limiting an adequate transfer of food from the stomach to the small intestine. It may fully or partially block the path of food. It can stop food from being digested. 4. Renal insufficiency as a result of dehydration. Renal insufficiency is poor function of the kidneys may that may be due to a reduction in blood flow to the kidney caused by renal artery disease. Normally, the kidneys regulate body fluid and blood pressure, as well as regulate from chemistry and remove organic waste. And lastly, death. Acute gastroenteritis accounts for millions of deaths every year in young children, mostly in developing communities. Nursing diagnosis. Impaired skin integrity related to constant presence of diarrhea stool. Supporting data, patient complains pain while defecation diarrhea. Objective data, when performed the perineal care, patients ski at the area loop weakness. Assessment. First, assess the overall condition of the skin. Rational assessment of the condition of the skin provide baseline data for possible intervention for nursing diagnosis. Second, assess for abdominal discomfort, pain, cramping, frequency, loss or liquid stools, and hyperactive bowel sensation. Rational, these assessment findings are usually linked with diarrhea. Third, evaluation pattern of defecation. Rational to help direct treatment. Fourth, assess the condition of perineal care. Rational, diarrhea stool may be highly corrosive as a result of increased enzyme content. Fifth, assess for fecal or urinary incontinence. Rational, stool may contain enzymes that can cause skin breakdown. The urea ammonia within minutes and it goes to the skin. Use of diapers or an incontinence pads hastens skin breakdown. Goal, patient skin of thickness will be decreased and also maintain a good skin texture and weight as normal level. Nursing intervention. First, encourage the patient to change position every 15 minutes and change chair-bound position every hour. Rational, to reduce the pressure over the sacrum may exceed 100 mmHg because any pressure above 32 mmHg leads to ischemia. Second, educate patient and caregiver about the cause of pressure. This information to prevent skin breakdown. Third, educate patient and caregiver about proper skin care. Rational to maintain skin integrity, encourage their sense of self-efficacy and prevent skin breakdown. Fourth, give anti-diarrhea drug as ordered. Rational to suppress gastrointestinal motility, thus allowing for more fluid absorption. 5. Encourage patients to eat small, frequent meals. Rational to consume food that normally cause constipation and are easy to digest. 6. Impart to patients the importance of good perineal hygiene. Rational hygiene reduces the risk of perineal excoriation and promotes comfort. 7. Encourage ambulation if the patient is able. Rational to reduce pressure on the skin for immobility, thus lessening the factor that may result in impaired skin integrity. 8. Avoid spicy, fatty food, alcohol, and caffeine. Rational, this dietary change can slow the passage of stool through the colon and reduce or eliminate diarrhea. 9. Clean, dry, and moisturize skin, particularly bony prominences, twice daily. Avoid hot water. If powder is desirable, use medical grade cornstarch. Rationale: smooth supply skin is more resistant to injury. This measure prevents evaporation away from skin. Evaluation: patients feel more comfort and frequency of diarrhea decrease after giving or the nursing intervention.
I will continue about the health education. Number 1 is wash the hand often. Use soap and water. Wash the hands after use the bathroom. Change a child diapers or sneeze. Wash the hands before prepare or eat food. Number 2, clean food thoroughly and cook safely. Wash raw vegetables before cook. Cook meat, fish and eggs fully. Do not use the same dishes for raw meat as we do for the other foods. Refrigerate any leftover food immediately. Number 3, clean surface and do laundry often. Wash the clothes and towels separately from the rest of the laundry. Clean surface in the home with antibacterial cleaning or bleach. Number 4, ask the child to drink liquids as directed. Ask the healthcare provider how much liquid to drink each day and which liquids are the best. The patient may also need to drink an oral rehydration solution (ORS). An ORS has the right amounts of sugar, salt and minerals in water to replace body fluid. Number 5, don't give the child soft drinks, fruit juices, fruit punches and sport drinks. This to avoid vomiting. Number 6, give good food for child. Good food choices for dehydra are noodles, crackers, oatmeal, rice cereal, bread or toast, potatoes, bananas, applesauce, and turkey or chicken. Number 7, avoid foods that are spicy, sugary or that have fructose. This to avoid severe dehydra. Number 8, offer the child yogurt with active cultures. This is good for digestion. Number 9 and the last, give the child probiotics such as Lactobacillus acidophilus. Because probiotics contain live good bacteria naturally found in the body. And that's all my group presentation. Thank you.